All right, well, I'd like to call this meeting the Health and Human Services Board to order at 10:32 a.m. on Thursday, December 9th, 2021. To note, I think that we do have a quorum to have this meeting. And was this a meeting properly posted? Wonderful. Then I would entertain a motion to approve a 17-point agenda.
So moved.
Moved.
Second.
Got a motion by Timothy Gotchel, seconded by Ingrid Glassbrenner to approve our 17-point agenda. All those in favor signify by saying aye.
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 Those opposed say nay. Motion carries. Would entertain a motion to approve our November 11th, 2021 Health and Human Services Board minutes. Any additions or corrections to those? Motion would be appropriate.
I'm not going to move since I wasn't here for half of them.
Motion by Ingrid. Is there a second?
No, I said I'm not going to make a motion because I wasn't here for the first half.
I'll make a motion to approve.
Dr. Barris makes a motion. Is there a second?
Second.
Seconded by Van Nelson. All those in favor signify by saying aye.
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 Aye. Opposed say nay. Motion carries. Citizen comments. Are there any citizen comments? Do we have any citizen comments? Anybody would like to speak at this time? Address the Health and Human Services Board. Hearing no citizen comments, we'll move on to agenda item number 4, the director's report. Tracy?
Thank you, Mr. Chair. I'd like to follow up from last month when we discussed the emergency CMS and OSHA regulations requiring COVID vaccinations. At that time, we knew that the OSHA rule did not apply to Richland County as an employer, but we were waiting for more guidance on whether the CMS rule might apply to programs in our agency. After quite a few statewide virtual meetings with Wisconsin Counties Association and the Department of Health Services, as well as our consultation with the Corporation Council here in Richland County, we've concluded that none of the services or programs provided by Health and Human Services fall under the CMS mandate. This is because our programs are not directly regulated by CMS. But with that said, on November 30th, one of the federal district courts issued an order that blocks the CMS vaccination rule. So it is not applicable across the nation right now. In other agency news, although we have hired some of our staff positions, we're still struggling to recruit for many of our vacancies. We usually rely on free ads for recruiting, but this last round we paid for advertisements for several of our positions. Unfortunately, no applications came from those efforts. We know that the labor shortage is widespread and not just affecting us here at Health and Human Services, but I'm concerned about how far we're stretching our existing staff. We're hoping that increased wages for 2022 will be a factor that helps both with recruitment and retention. With behavioral health services, our staff are getting ready for program recertification site visit by the Department of Health Services. This will take place on January 11th. This is a recertification of our mental health and substance use outpatient clinic, our comprehensive community services program, and the crisis services. Miranda and the behavioral health and administration staff have been working really hard to prepare for this. It's a lot of work getting all the records ready. The Birth to 3 and CLTS programs recently completed their annual Department of Health Services review. We anticipate feedback from this review early next year. The children Child and Youth Services and the behavioral health units, along with our CCS contracted providers, will participate in a training tomorrow on Friday, focusing on childhood trauma and how to best work with individuals who've experienced traumatic events. Our behavioral health staff continue to pitch in to support both our crisis services and adult protective services, in addition to the regular duties during our staffing shortage with those programs. All three of our APS and crisis positions remain vacant, and we continue to try to recruit for them. With Child and Youth Services, with 2 vacancies in that unit and 1 worker on family leave, staff are needing to cover daytime and after hours on-call duties more frequently. Our new case manager, Shelby Miller, has now completed the necessary training to be able to begin assisting with on-call. And 2 staff who transferred from the Child and Youth Services unit to the ADRC have agreed to continue participating in the after hours on-call coverage to help out the team. Our newest case manager, Emily Phelps, who started on November 11th, still has to complete required training before she's able to perform on-call related duties. Despite the staffing shortages, Child and Youth Services staff are gearing up to offer some added visits during the holiday season for families who have children in placements. Although these visits are not able to be held on Christmas Day, we'll try to help to make them more holiday celebrations by providing some gifts and meals to the families. In economic support, the state's implementation of the new call center called Genesis was delayed last month in order to work out some bugs, but now we'll go forward with being live tomorrow on Friday. We will still be asking our callers to be patient, as there's bound to be more glitches that we need to work out with the state. Healthcare renewal requirements are being postponed another 3 months. So no recipients of healthcare will have their benefit end prior to the end of March. We continue to be busy with the Wisconsin Home Energy Assistance Program, or WEAP, and encourage everyone who needs this benefit to apply. The number of applications have been fewer here at our office, but this is likely due to the availability of a new online application process. The online applications are processed at the state level rather than here through Health and Human Services. So we don't always see that people locally are getting that benefit. In our 2 new, our 2 new employees for economic support started on November 29th. So now the unit is fully staffed. The new staff have begun the extensive training process, which takes approximately 3 months before they can fully be on the call center. In the ADRC, our manager, Roxanne Kluber-Kans-Gerber, is currently on medical leave and will be out until January 5th. The regional ADRC director, John Grotham, will be coming into the office in Roxanne's absence to provide some supervisory support to staff. The ADRC was recently allocated funding from the regional office for outreach related to dementia care specialist program. So as a result, you will notice that there are some billboards promoting awareness. They're located on Highway 14 West and Highway 80 North. Also, the ADRC recently got news that our application for the 5310 transportation grant was successful. This award in the amount of $29,367 will be used for the bus program. And for public health, before Rose gives her health officer report, I'd like to mention just a couple of things. First, I want to congratulate Rose and the public health staff for completing the recertification process to continue their status as a level 2 health department. The time and effort preparing for this was significant, especially in the midst of all of their COVID-related work. And second, I want the board to know that we recently received notice that the medical director for public health, Dr. Tom Richardson, will be retiring at the end of this year. Dr. Richardson has been in this role since in the 1980s. I don't think we have the exact date. We thank him for his many years of support and dedication to public health and wish him well in his retirement. And I'll let Rose speak more about what this change will mean for the public health programs. And that's my report, Mr. Chair. Are there any questions?
Thank you, Tracy. There's not any further questions for Director Thorson. Move on to our Health Officer Rose.
And I'll just move the conversation along where Tracy left off. Yes, indeed, we did receive written notification from Dr. Richardson of his desire to retire as of December 28th. So we are actively seeking another medical director given his upcoming absence. I did reach out directly to the Southern Regional Office for guidance because this is actually new territory for us. As Tracy mentioned, Dr. Richardson has been acting in this capacity for 30 or more years. So right now I reached out to one individual actively practicing physician who's a local MD, and that person verbally has given me his confirmation that he's interested in this. However, I did ensure that he received formal information from the Department of Health Services so that he can look over a broad job description and then also look at the statutory requirements to ensure that that person is still interested. We do need to move in a rather expedited fashion because based upon information I received, we need to have a medical advisor in good standing here in order to even remain operational. The standing orders that we have signed and other policies that were completed and approved by Dr. Richardson, I do need to have a physician available to provide that oversight and that approval of some of those documents and some of those standing orders so that we can, like I said, remain operational. So once we know more, we will be bringing information to the knowledge of the Health and Human Services Board, and we'll be looking at an approval process. So I'm hoping that we can move this along. If for some reason this becomes in any way, shape, or form protracted, then I will be reaching out to see if we can secure someone to act in that capacity on a temporary basis. So that's where we're at right now. And again, I'm very happy that we did secure our status as a level 2 health department. We did have a virtual interview at the end of October, and we were fortunate to have a representative come from the Southern Regional Office to actually provide us with our designation that we have posted here in our office. The abbreviated 140 review actually was allowed to occur as a placeholder in lieu of a much more extensive on-site 140 review, but we will prepare for that. But at least based upon the language in the designation, we are in good standing for 5 years. That's the time frame over which public health departments are reviewed. Although I fully expect in the next year or two to be in a position to complete that large scale 140 review. And then as far as COVID activity, that's always that's all we're doing, to be honest. When we look at our burden of COVID activity here in Richland County, we know that in October, we actually had more cases than we'd ever seen before. I believe we had 432. Mercifully, in November, it did decrease to 183 cases. However, we've seen an uptick in cases here in December thus far. We don't know for a fact, without my reading each case to see what types of interactions folks were having. I don't know what impact Thanksgiving may have had on that. However, as of yesterday, we had 61 cases already, and we brought in close to 40 in the last couple of days. So we're really moving ahead. And not seeing much of a relief, at least here as far as December goes. We are seeing a fairly high and sustained level of transmission in children. And when we look back, when I look back at the end of September, we had 222 cases, and that had gone up 84 cases in children aged 10 to 19 during the month of September. Since then, I believe we're looking at 362 cases in children between the ages of 10 to 19. And when I took a look at our state system over the last day or two, we are definitely seeing an uptick in children who are considered close contacts and those who have tested positive. So we're really seeing a lot of activity in children who are school aged. So a lot going on there. And so just something to keep an eye on, but yeah, we're staying very busy. Others, I mean, and then we're continuing to do vaccines, whether they be first, second, additional, or booster dosages of vaccines. And we're also assisting at testing sites as requested. For a while, we were providing support on a pretty regular basis. And then the emergency medical services staff that they thought that they could manage it, given the burden of contact tracing that we're doing. But we are available, and we have been providing at times assistance with testing and continue to do so. With regard to nutrition, I believe things are fairly status quo. Again, continuing to do 3 different levels of meal delivery, whether it be, or actually probably 4. We actually have the congregate sites available for folks who are comfortable attending. We have frozen meals that we provide to folks. We do have hot home delivered meals at least 3 days per week here in the Richland Center area. And then we still offer the grab and go option for folks here that want to come to the campus. So still very busy. And I know that in October, and I think in November, we were seeing a real uptick in interest from the community in seeking meals for either themselves or for their family. Any questions? Thank you.
Thank you, Rose. Agenda item number 6 is our expenditure report, vouchers and expenditures over $2,000, but less than 10,000. This be Stephanie.
Hello, that would be me.
Wonderful.
Okay. All right. The first couple of pages are just mileage reimbursements, mileage and expense reimbursements for our volunteer drivers. So if we start on page 3, I think we can start right off with the Capital Newspapers total of $1,024. As Tracy had mentioned earlier, we have several, and you'll see it throughout the vouchers here, several entities that we spent some money on in an attempt to reach a broader audience, basically just doing an aggressive ad campaign for a couple of the positions here, the supervisor positions in particular. So this was money that we spent with Capital Newspaper. So then through item number, 74, and if you keep going to page 4, there at the bottom, card member service, our vendor total of $2,823.64. That's our credit card. And really on that is just a variety of our usual expenses. Our monthly carry-o bill, which is that the $14.14 up top, and then our monthly Clockify bill, and then we had a smattering of some computer-related expenses, laptop bags, things like that. If we jump to page 5, yeah. So at the bottom of page 4, you'll see CDW government, and then all the way through page 5, and then on page 6, kind of in the middle there, the vendor total $4,856.36. That is not a normal monthly thing there where we spend money with CDW. It's just a lot of invoices that came in that got forwarded to us by the MIS director. They were going to her. And some of they go even back as far as September. So this is just basically a catch up on a lot of computer supplies, again, computer items, things like we had multiple UPSs die and that need to get replaced. Headsets, we got some headsets, we got some monitors, new monitors to go with the new computers. There was a compatibility issue, wireless mice, so just various miscellaneous computer items over the course of a couple of months. Then let's see, then the $2,125 on page 6, kind of in the middle there, item number 23, that's our final quarterly payment for our environmental services person, Troy Morris, to work with us in our county. If you go down to item 26, passages, that's just a pass-through that we have. The county pledges $2,600 a year. And so that's their second half of the year payment for that. If we go to page 7, page 7 is all Quill. And the total for Quill is at the top of page 8, $2,005.83. Again, Quill is our office supply company, so it's various office supplies, cleaning supplies, file folders, labels. We had to purchase an electric paper punch, our other one died. And then also included in that total is our annual calendar purchase. The agency purchases calendars for the individuals that would like one. Then down in the middle there, then after Quill starts Richland's, the Richland Observer. So the bulk of that total of $441.50 is hiring ads. And then River Valley Newspaper is $1,499. Again, that was our attempt to just reach a broader audience to try and see if we could get applications for our supervisor positions. And then we start with shopping news on 8, ends on page 9, kind of in the middle there, $1,829.25. That's shopping news, again, mostly hiring ads. There are some, I believe there's some substance abuse prevention marketing materials that were also purchased through that. And then I think that's it. Page 10, I think that's it for highlights. Page 11 is our prepaid vouchers, and just those are standard items that we pay ahead of approval, just to avoid late charges and things like that. I did go through all of these yesterday with Clint Langrick, the county administrator, and he already signed off on approval on these. But if anybody has any questions about any of the items, go ahead and ask. Super.
Thanks, Stephanie. Let's move on to agenda item 7, our 2021 budget summary and county placement report.
All right, take a sip of something here. All right, budget report. We're winding down here. We should be at about 92% utilization. As you can see, not most everybody is under that. A couple of places where we're over. So I'll kind of go through and kind of explain the unders and the overs. For building and operating costs, and I mentioned this last month, it's at 109%. That is due to the insurance expenses that hit the books was last month. So that should level off. It shouldn't keep increasing between now and the end of the year. If we were to take that total, the difference out of what was budgeted versus what we actually ended up paying, it would be more around the 80% area of utilization. For public health and again, same thing. COVID has really hit our budget in that area, but the thing that we need to note is that there is COVID funding to offset those expenses. So we're going to be able to capture quite a bit of that to cover that. If we go down to elderly services, I think the big thing there is in that area, and then in a couple of the other areas. Well, in this area and in transportation and nutrition, basically, because the first of the year was a little bit slower and we really didn't pick up in those services until later in the year. That's why those are down a little bit, but they're slowly getting busier, and more expenses are coming in. Economic support, ESS programs. I think there, and you'll also see in some other areas as well, children and youth services, mental health outpatient crisis. There's been vacancies, some, and as you know, vacancies, and then some positions that we haven't been able to fill, such as our the APS crisis worker position hasn't been filled either. CPS contractual services, the 51%, just simply low utilization of the contracts, which we can say the same for like AODA treatment and treatment court, CLTS, just service utilization is just lower. If we jump down to CCS, we'll see that that's that utilization actually is higher. So that's why that is above. But again, side note that there is revenue to offset those expenses. If I keep moving down, APS, again, that's the big one where we really see a low number there due to the APS position being vacant for quite a significant part of the year. And again, the APS crisis position that hasn't been filled. And I think that's pretty much it. So then if we move over to the middle, core budget balances, anticipated revenue, once once I put together all of the revenue, so these expenses are for through the end of November, actual expenses. And so then what we end up doing is we have to add in the revenue that we anticipate after doing claims. So once I plug that in, and then some anticipated expenses that aren't reflected yet, do the math on all of that. Then we do our mental health institute charges, where we add those back in again, because those should not hit our core budget. We're looking at a projection of about, I'm projecting, this is very fluid, projecting about $44,000 surplus. But also note, there's some revenue that we're not really sure about yet. WIMCR amounts are unknown at this time. It's done. We're just waiting for the notification that it's out there so we can go see what the reports are and see what that number is going to be. And again, the one thing that I don't have in anticipated revenue is the reimbursement amounts that we can claim for the COVID expenses. And then we're also waiting to hear about enhanced Medicaid funding from the consortium. We know it's available. We just haven't heard amounts yet. So they said it should be coming soon. So I don't know what those amounts are. So while the core budget is really sitting about at a surplus about 44,000, we've got some other revenue sources that we're waiting to hear on. And so that could definitely change next month. So any questions or? Quiet, that's good, I guess. All right, I guess Tracy's next then.
Sure, I'll just move on and show you the information on our placements. So adult institutional placements, you can see it in October. And again, all of this, these reports go through October. We don't have enough of the information for November to include in this report. You can see that we had an increase in placements at Winnebago for October. So there's a higher number there. And no utilization of the crisis stabilization for October. So right now, crisis stabilization expenses are $49,007. The adult institutional expenses are $156,824. I'll scroll down to the community residential placements. That has stayed relatively steady. We did have one additional placement. You can see we moved from 9 to 10 individuals in placement in the month of October. And I'll remind you, you'll see that the number, the expense number for the month has dropped beginning in September and October. And that is because we are trying to place more of that high cost CCS placement into the CCS core budget. We have to kind of see what happens with WIMCR, how much we can absorb of that high cost placement into the core budget, but we are moving some of those expenses, and that's why the cost is down for the placement expenses, although the number of individuals in placement has remained roughly the same. So for community residential placements, through October, our expenses are $381,747. For the adult placement fund, Fund 54, we started the year with $482,278. We have so far had $587,578 in expenses, and so that leaves a negative balance in that fund of $105,300. With child placements, so inpatient has not changed very much, and a little bit, 9 days of juvenile detention were used in October. Our total detention costs as they stand are $23,400. Child institutional expenses through October are $172,145. And child foster care, treatment foster care placements, we have had, I think, the number of placements has stayed steady in the last 3 months. For group home and treatment foster care, our expenses through October are $362,238. Regular foster care are $25,170. So for the child institutional or child placements, excuse me, that's Fund 44. We started the year with $523,341. Through October, we have $582,953 in expenses. And so that leaves a negative balance of $55,612 in Fund 44. To show you kind of the comparison from month to month, you can see that 2021 is the dark blue, and it shows overall our placements expenses have been down. And then kind of the projection comparison to previous years, if the placement expenses continue for the last 2 months as they have for the first 10 months, we're projecting $1,404,638 roughly to end the year. We'll see, you know, a high cost month could kind of shift that up, and a low cost month could shift it down. And then just to show you kind of the different placement types, what might be driving our higher cost expenses. Our adult institutional and inpatient costs are actually lower than previous years. We project to end the year about $188,000. Adult community placements are higher, and that's mostly driven by that one very high cost placement. We expect to end the year at $458,000 roughly. Crisis stabilization, our projection for the year end is around $59,000. And we want to keep using crisis stabilization because it can be used as a step down or as a means to divert the need for institutional placement. Child institutional and residential treatment looks to end the year at about 206,000. Juvenile detention, right around 28,000, depending on what happens in the next 2 months. If we have fewer placements, that'll probably land right around 24,000. Group home and treatment foster care, that's where our higher child placement expenses have been in 2021. We expect to end the year right around 435,000. And regular foster care has stayed relatively steady in the last 3 years. We look to end the year about 30,000. And I think that's all I have for placements. Are there any questions for me?
Hearing no questions for Tracy on our county placement reports. Move on to Angie with our contract monitoring.
Good morning. Okay, there's the contract monitoring report. This is bills largely we've received through October. That's the month we've been invoiced for most. There's some November and December in there already though. So we're looking at 83% utilization, and anything above that on the far right-hand side, I'll point out. So the first one is the Children's Hospital of Wisconsin, about 4 down. That is quite high, even though they've billed us through November. Jess and I talked about it last night, and she did have an additional child placed with that provider. So we will be looking at next month amending that again, once we kind of know more of the details of how much that cost is going to be for that extra child. Just below that is Cholita. It is at 87%, but they have billed us through November as well. And we were really just looking at that 83% utilization through October. So that one should ride out okay. Page 2. Right in the middle, Artisan's Shop is at 95%. I've mentioned this before. I believe that has been completely utilized for the year. They built a fence for a child with disabilities. So more than likely, there will be no additional expenses by December. So it should be just fine. Page 3, I did not find anything concerning there. Or on page 4. Page 5 is the one I always mention at the top is Cario, 86%, but they do bill us always a month ahead of time. Nothing concerning on page 6. And page 7 is fine as well, just one provider there. So. And that's all I have for today. Look, everything's looking pretty good.
Questions or concerns? All right, agenda item 9, approve our contracts, agreements, and amendments.
So I did swap out, and yep, there's the new one that has an additional provider that was brought to my attention by Lori Cooey yesterday, and that's CR therapy. So the first one though is Shay Rehabilitation. And do I see Miranda's got herself, it looks like kind of off. So I can, unless, oh, there she is. Okay.
I apologize. I needed to leave for a court hearing just briefly. Yeah, Shay Rehabilitation we'll be working with for our CCS services and providing some community-based mental health services through the CCS program, a newer agency. And then CR Therapy will be providing services through our children's long-term support services. Both are fully funded Medicaid services. Working with children with disabilities is a CR Therapy.
I neglected to mention, these are all for 2022, not 2021. So for that entire year.
Oops.
Any questions or concerns with these contracts for 2022? Then motion would be appropriate to approve those.
I can make that motion. Glassbrenner.
Second, Gatchel.
Motion by Ingrid Glassbrenner to approve our contracts for 2022. just two of them. And seconded by Timothy Gotchel. Is there any questions or concerns? Let's be approved at our December county board meeting to be ready to go in January.
It should be. I haven't forwarded it on. I usually wait till we get through this meeting.
Okay. No other comments? All those in favor signify by saying aye. Aye.
Aye.
Aye.
Opposed, say nay. Motion carries. And we had agenda item number 10, personnel updates. Wonderful.
All right, yeah, I'd like to announce that we have hired Nicole Gaudette as the new Information and Assistance Specialist in the ADRC. Nicole transferred from her position at the Child and Youth Services. I mentioned earlier in my report that Nicole has agreed to continue to assist with the after hours on call with Child and Youth Services until we get fully staffed in that unit. And that was, I think it was effective the 22nd of November. And then also, unfortunately, have to announce a resignation of Veronica Olson, who's a secretary and has been pretty involved in helping public health with managing the vaccine clinics, doing the scheduling for that, and also working at the front desk. Veronica is going to go over to the registrar and probate office. So the county's not losing her, but Health and Human Services is. So I'm sure she'll do a great job over there. And then with just telling you a little bit about lease staff, we did have Liz Bjorklund, a mental health therapist, resigned. That was primarily due to some personal health issues. So we're sorry to see Liz go. And we did hire Diane Cox, who is currently a Health and Human Services board member. And I think we'll talk about that on the next agenda item, as a LTE APS consultant to help out with our APS staffing issues. And as you probably recall, Diane, before she retired from Health and Human Services, was the APS worker. So she asked if we could use the extra help and very graciously volunteered to come back and work for us while we need that extra assistance. I will share with you the staff vacancies here on the screen. I think we have about 9 vacancies that we're still trying to fill. So the secretary position that I just mentioned for our administration and building operations unit, we're still trying to find ADRC driver. In behavioral health, we have a position for a CCS supervisor, APS worker, the APS crisis professional, a mental health therapist position, and a psychiatric nurse position. And in child and youth services, we have a case manager position and supervisor position. All other positions that are on the books for Health and Human Services are currently on hold because they were not included in our budget. Are there any questions about any of that?
Mr. Chair.
Go ahead, Mr. Gotchel.
Tracy, this seems to be pretty dire. I mean, it has been for a while. Is there any consideration to approach either Administrator Langrick or the Finance and Personnel Committee to further incentivize the folks that are sticking around, you know, to do the work? And I mean, setting recruiting troubles aside for a moment, you know, this is work that needs to get done and can't get put off, obviously, for the county. Are you aware of any new initiatives?
At this point, there have not been, and I think you are raising an important issue for Health and Human Services in particular. We've been holding out a lot of hope for what the wage increases might do. But I think that would definitely need to be the next step of looking at, are there any other kinds of incentives or activities that we might do to encourage recruitment? We definitely know that there's a labor shortage across the board everywhere, but our staff are getting pretty stressed, and it's in every single unit where staff are taking on extra things. If their unit is fully staffed, we still have many of those staff volunteering to help out in other areas as well. So I appreciate your mentioning it, and I think that really would be the kind of the next thing for us to do, especially after we made that big effort of actually paying for advertising of many of our positions, trying to see if that would help us recruit. And certainly it's not a good time to be recruiting in December. Of course, that's not a great time to get a new position on board, but I still think that we need to be looking for other means.
Yeah, yeah. Mr. Chair, I know it's not on the agenda, so I'll be careful what to actually talk about here, but I personally, as a board member, would be interested in seeing if we could shepherd forward some sort of bonus or retention program or something. I mean, we're not paying salaries, obviously, with a lot of these vacancies, so we have some surplus. I guess, Carrie, I'm a little kind of at a loss on how to get something like that started. So that start with Tracy and Clint, or should that start with us? Or
And Tim, can I just clarify, you're speaking about 4 employees that we currently have, not incentivizing our advertisement, those that we have, like.
right? No, we need to. I think the problem's twofold. Obviously, as someone who's trying to hire every day in my day job as well, is you need to incentivize the folks that are still there in a very, very competitive market to stick around, and then not mutually exclusive, but a different item would be, how do we bolster recruiting? I'm more concerned about hanging on to the good folks that are still there.
Mr. Chair, if I may, certainly if again, it's not on the agenda, but if there's interest from the board, I would like to bring a presentation forward next month with maybe a proposal that maybe could go through the board and committee approval process.
I think that would be most appropriate right now, and I'd like to have something that would come formal from this board to then further go on to the personnel committee at the county, along with Administrator Langrick. I've had some personal discussions about this, and there just seems to be pushback and not wanting to do anything because of the budget. Okay, that's all I hear is the budget. We didn't have it in our budget, so I wish us luck.
And if I may add just one piece of information, while I recognize that the labor shortage predated COVID, COVID funding, I know that perhaps the labor issues have been exacerbated by the COVID-19 pandemic. Perhaps people prefer to work more at home, or whatever that case might be. And as Tim mentioned, there is indeed a competitive market. If there's any ARPA funding or any money that was not already considered part of the budget that might allow for some of these additional incentives for existing staff of folks from all county departments possibly, but HSS in particular, I would definitely support an exploration of that.
I think that would be a good discussion for next month.
I also think you need to look at the expenses of advertising. I mean, I know the position we just lost, she would have stayed for a little more money, and instead we put it all into advertising and now training and short staffed for her leaving. It's tough.
Yeah.
All right. Let's move on to agenda item number 11. This one was regarding board member Diane Cox. I reached out to Tracy. She advised me what was happening, and then I've also contacted Attorney Wendell and Administrator Langrick. And I don't know if you've done research too, Tracy, at all. I don't know if you want to talk about it or.
Yeah, it's certainly, as the Health and Human Services Board knows, that someone cannot be an employee of the county as well as serve on a board or committee. And Diane is very aware of that. So I reached out to Diane and Administrator Langrick just to kind of find out what Diane's intentions might be. She certainly voiced that she saw the greater need because she has this specific knowledge and skill base for APS, that she sees the greater need with the agency, and thought that she really, that's where she could kind of give most effectively. She did say that, you know, if the need is short term, she wondered if she might be kind of on a leave of absence from the board. And if by January we still are not able to recruit someone, perhaps she would just resign from the board. But she's certainly understood that it's kind of up to the board as to what you want to do. My conversation with Administrator Langrick was similar, that he felt that the board could decide if you felt that it was better for Diane to go ahead and resign right away and then start to seek another board member, or if you felt that it would be okay to wait and see if she could return to the board. So I leave it to you as far as whatever you think is appropriate. That's what my research brought.
So what is the board's wishes? I believe, I thought was under the impression that she would have to resign completely from the Health and Human Services Board to fulfill that position that she's working in until she's done. Then she could reapply again to the Health and Human Services Board and be appointed again by the administrator. So what would be the board's position on this? Where would you want to go? Have Diane resign right now, she's working, and then fly back when she is not on county dollar, I guess, being employed.
Well, I'm confused. Which one, I mean, do either of those options, they're permissible within the, I guess, rules of the committees? Are both of them, sorry.
I apologize. I did not consult with Attorney Wendell, so I don't know if he suggested that she really does need to resign, then certainly that's the answer.
Carrie, is that, so when you're saying that, is that what his official recommendation was? He didn't mention a leave of absence or anything?
Well, Mike didn't say nothing, but Clint did. I wish Clint was here right now to talk. So we could call him.
You want me to try to reach out to him?
Yeah,
Perhaps we could just wait or move on to another agenda item and then come back.
yeah, that would be great. So number 12 is approve the new Commission on Aging Disability Board member.
All right. So the Commission on Aging and Disability Board approved recommending Julie Cervantes to fill the vacant advocate for disabled youth or young adult position on the board. And so we'd be asking for the Health and Human Services Board approval and forwarding that on.
So we have the backgrounds up in front of us here. What is the committee's wishes on approving Julie?
Can I just ask, is she, because it says it consists of board members, community members, and service organizations. You're saying she's not a community member, right? She would be I'm sorry, I'm just confused.
Well, she is a community member and she would be representing
Okay.
they have different roles that they need to make sure are filled on the Commission on Aging Board. And so the role that she would fill is that advocate for disabled youth and young adults. So she is a community member.
Okay,
I
So
was
motion-
able,
Okay, go ahead.
sorry, Clint will be on in 2 minutes.
Okay.
Tracy or Carrie, could I-
Dr. Barris, go ahead.
yeah, can you just give us some background on this patient, on this person? I really don't know her at all or know anything about her.
Boy, I apologize. I'm kind of stepping in for Roxanne and I don't know her background other than what's on the attachment here. I know that she was presented to the Commission on Aging and Disability, and so they had determined that she would be appropriate on their board and recommending her to the Health and Human Services Board. I apologize that I don't know any more about her.
Van, are you on that committee?
I wasn't at that last meeting, Carrie.
Okay.
I could check the minutes and see if I can find any more detail.
Good. So we got 2 items on, I'm gonna put on hold here. Agenda item 12 is gonna be on hold right now. I see Clinton's online. So will we go, well, Angie's looking up to see if there's anything with agenda item number 12 before the approval. Then we'll go back here to agenda item number 11, which is discuss Health and Human Services Board member issue. And Clinton, this here is regarding Diane Cox. I know you and I had a conversation here later last week about this, and you advised me of what Attorney Wendell's opinion was of the situation, and I was under the impression that Diane would have to resign from Health and Human Services Board. Well, she is an employee, correct? And then she would have to apply back again if she wanted on Health and Human Services Board when she
Yes,
was not an employee anymore, correct?
Correct. Opinion coming forward through Corporation Counsel, of which I concur with discussion with him, is that there would be a conflict of interest there on having her serve on the advisory board that would oversee contract and employment.
Okay, so is she up in the air right now, Tracy? Like, does she want to continue with the APS worker as a contracted service, or is she just feeling it out?
No, she's currently employed. She's
Okay.
employed as a lead staff right now.
so then my question would be, Carrie, is are we obligated to fill her position after she resigns, or can we just hold until she gets back?
I don't know. I think I'm gonna leave that up to Clinton. I think you have some background on this, Clint.
So our language that we just referenced a few times in rules and resolutions, I think, let me pull it up here. Stand by. Goodness here. Talks about having a prolonged absence, if memory serves. So it says on here underneath our Rule 6, except as the Highway Committee and Board of Trustees of Pine Valley Village, the county board shall have the authority to make temporary appointments upon a prolonged, unexcused absence of any supervisor or citizen member of any committee, board, or commission after the approval of such appointments by the county board. Such temporary appointments shall cease upon the return of an absent member. So if we have a situation where Diane is in a temporary type of capacity, it appears we have language here where if Diane were to file like a a letter or some type of communication to the chair asking for perhaps an excused absence, then they would kind of hold the seat or retain the seat open. On top of that, if you wanted to advocate to the county board to have a temporary appointment, you could have it, put it in place. If you still have an adequate number of the body to perform the functions that you need, then you could probably just leave the position vacant if there's reasonable expectation that Diane's going to be returning to it. But we don't really define what prolonged is, so I would defer probably to the chair as to what prolonged means.
So, in my opinion, kind of want to stray away from prolonged absence for knowing that issue why she's being prolonged absence would be to seek employment from Richland County and then leave that spot open and have her come back. I have a hard time with that. I think if it was a family related issue, a health related issue, she needed to be off. I could see that, but kind of looks bad to the public if we were to let her step down, work as a county employee, still oversee the wages that's going to her, and then when she's done, allow her to come back on. That seems like we're, in my opinion, it looks like we're doing favoritism. And I know that's been an issue before in the past. Though I don't think that was the intent of Diane, that she's trying to make money or profit off anything, but there also was some issues the other day that Clinton and I talked about that didn't make any sense, but whatever. What is the committee's wishes here?
Well, it sounds like the first thing we would have to address is that she needs to resign according to the rules of the board. Correct? That's
Yes.
what the official, so I guess do we need to make that a motion?
I don't think that we need to make it a motion. I just think that that's what she needs to do. If she needs to resign from the board, if she's going to accept any money from the county.
And then her position was as community member, is that correct?
Yes.
So you're saying you think that we should repost that position then after her resignation?
Well, I think what Clinton alluded to is that we could keep it open because we would have enough. We're coming into where we're like, what, 4 months away now, 3 months away, 3 meetings away, I guess, from having a new Health and Human Services Board.
But
So
her position wouldn't be dependent on that, right? A community member doesn't change at that same time, does it?
It would depend on the years part of it. You're right, but it all comes down to what rules and resolutions decided and what the county board is gonna probably be approving next Tuesday. The appointments are correct, Clinton?
I'd have to reference back to it. So the boards and commissions, I think, were a little bit different outside of conversation regarding committee.
Okay,
I think our Health and Human Services Board, and I don't know this off the top of my head, might still have kind of state statute language that talks about how much their term in service is in place. Correct me if I'm wrong, Director Thorson.
I believe that's correct, that the state statute does outline that. And if I understand it correctly, and is that if Diane resigned, someone would fill her existing term. And so they would carry on however long that term was set.
And
we
hers
know-
is through April 2024. I just pulled up the board terms.
That was going to be my question, Mr. Chair. It sounds like that's a pretty long assignment, or she's pretty new into the role. So I think for the reasons that you stated, I would be in favor of probably recruiting.
Yeah, and that April 2024 is just her first term. She could go to 2027.
the 6 years, yeah.
It was new.
All right.
Do we need to make that a motion or can we just all say we
I think,
agree?
I think this falls into Diane's hands at first here, where she needs, I guess if she already is, then she needs to make a choice, I guess. So she wants to still stay on Health and Human Services Board, then she just needs to stop being employed contractedly by the county. Or if she wants to continue filling in the role of APS worker and helping out where the greater need is, which I concur with that one too, that she would have to resign from Health and Human Services Board. And then make a determination if she wants to reapply back again, if there is an opening.
So should we make a motion dependent upon her decision that we would then recruit for that position?
That would be a topic of discussion for the board here right now.
Well, I mean, I'm in agreement with that. Dr. Barris and Van, I haven't heard from.
Yeah, I think right now Diane's intentions are somewhat vague as far as returning or how long she'll be working with HHS. Is that correct, Tracy?
Yeah, she's essentially said that she will work up to April. So she doesn't want to work past that, but she will work for several months if the need is there to help us out.
Never had to deal with this before. So she said that she would work until April, so that would mean essentially 3 meetings that would be unfilled here. And Clinton, you said that the rules of the board state for temporary leave of absence, right?
The language on here is the county board chair shall have the authority to make a temporary appointment on the prolonged, unexcused absence of any supervisor or citizen member of any committee, board, or commission after the approval of such appointments by the county board. Such temporary appointments shall cease upon the return of the absent member. Permanent vacancies as citizen member seat of a committee, board, or commission, except the Board of Trustees, Veterans Commission, and the Aging, shall be filled by the county board after receiving recommendations from the supervisory committee, et cetera. So it infers kind of what is happening. It doesn't kind of spell it out. It just kind of says that the board chair shall have the authority to make a temporary appointment upon a prolonged or unexcused absence, inferring that a prolonged or unexcused absence is grounds for separating the serving citizen member or supervisor, and then the mechanism of how to fill it. So again, having Diane as part of the committee, or I'm sorry, as part of the board and making any types of decisions with that board is seen as a conflict of interest. If there was some type of letter such of asking for a excused absence from the board for such a period of time, maybe that's more acceptable. The most legally sound is a resignation of the board while serving as an employee or a contracted employee.
Mr. Chair, do you suppose we could move I think if she's taking employment, like it sounds like she is today, that she needs to be removed from the board. I don't think we can, stating the reasons that you mentioned, public perception, et cetera, I don't think we can leave her on the board pending a decision. Could we vote to remove her from the board and then subsequently vote to recruit a new citizen member on April 1? So we have a plan to fill the position. Potentially Diane would be done with her term, or we could say April 30th or whatever, would potentially be done with her commitment with HHS and then could reapply, which would assume we would graciously accept her application in April.
Well, she would have to go through an interview process or something like an appointment process. Clint, do you appoint? Is he still on or did he get off?
I'm here, Mr. Chair.
Are you the one that appoints then the citizen members of the Health and Human Services Board?
Yes, it's an appointment by the county administrator, confirmed by the county board.
Okay, so we could leave it vacant until March and then apply in March for appointments to be, but then the administrator would have to make the decision then. She would have to reapply and go through Administrator Langrid's interview process or whatever such, I guess, to be fair and equal to anybody else if we do advertise it publicly, when we do. I think she needs to resign. She's already a contracted employee. She needs to resign. That letter needs to be submitted. I guess you don't really need to vote and approve her resignation because is what was discussed in August of 2020 at Finance and Personnel meeting. I remember there was a discussion about you shouldn't need to accept resignation letters because people can come and go as they please and alluded to slavery. So I think she just needs to submit that letter of resignation. And we know that we do have an opening now. And I think that we're fine. And I don't think that we need to recruit at this time. Maybe a motion would be appropriate for when we need to start recruiting for another board member.
I think what Tim's motion, as he had stated it, seemed to cover all the bases. Are you making that motion, Tim?
Well, I don't want to unnecessarily vote to remove Diane if we don't need to do that. If
I wouldn't
nobody
want to
else-
do that either. That's what I was kind of alluding at.
Excuse me, Mr. Chair, I know from my conversation with Diane that she would readily resign if it's the board's thought that that's really what needs to happen. And I'd certainly be willing to share that information with her.
Yes, she would need to resign from the board and then apply back when we have an opening. And post it that there's an opening. I think we can get by for a couple months.
So then we don't need to make a motion at all this meeting.
Okay,
Doesn't sound like it anyways.
Sounds
or
like,
just,
I think the language is there that she has to resign. Is that correct, Clint? I mean, it's not our obligation to remove her.
It's seen as a conflict of interest that would relate back to state statutes. It's not anything that we have in our board rules.
And then if she's working at HHS, I assume she'll be in contact with Tracy, who can give us her intent to come back on at whatever date, and we could go from there.
yeah. Well, what we do, we'd have to have it posted for anybody to apply. It would seem like favoritism. To be equal to everybody. But I feel that we can wait right now and not post an opening for the Health and Human Services Board if Clinton's okay with that.
I'm okay with that. If you folks can make it work with one less, I'm okay with that.
Well, this is the board's pleasure. That's where the motion would come into. So we have some clear direction. Would there be a motion to wait till posting in March? Or would you rather have it posted right now and filled as soon as possible?
I would make a motion to reassess at our March meeting, which I believe is March 10th. Reassess posting for the citizen position on the HHS board.
So we have a motion by Timothy Gotchel to reassess and post of a posting for a citizen board member at our March 10th meeting. Is there a second?
I can second it.
Seconded by Ingrid Glassbrenner. Is there any further discussion? Hearing none, all those in favor signify by saying aye.
I,
Aye. All those opposed say nay. Motion carries. So right now, a letter of resignation stating that she's resigned, and that note that we just passed the motion down not to fill HHS board member until we reassess in March. That's what I have standing right now. So agenda item number 11 is done with, and we're going back to agenda item 12. Angie, what did you find out, anything?
Yeah. So she was recommended to the Commission on Aging and Disability Board by David Scribbins. What else they could tell me is they know that she lives in Muscadet, but her address is Richland County. And she has 2 disabled children, but they're uncertain of any sort of employment or past board that she sat on or anything like that. That's all they really know. The person I talked to that was in the meeting. That's our employee that took the minutes.
Mr. Chair, Miranda sent me a message. I see Miranda, you're back on. I don't know if you want to share what your message was.
Yeah, just from living in the community, I believe that she is a veteran, who I just said, yes, she would be able to adequately represent individuals with disabilities.
All right, so we kind of heard of a little bit of background that Dr. Barris requested. What is the board members' decision? I'm moving forward with selecting Julie. Motion be appropriate.
I'd move for approval.
Is there a motion by Timothy? Is there a second?
Second,
Seconded by Dr. Barris to approve Julie to be on the Commission on Aging Disability Board. Any further discussion? Clinton, would this one here also be appointed by you?
Sorry, for which body, Mr. Chair?
The the Commission on Aging and Disability Board?
Yes, I believe that the commission is also an appointment by the administrator confirmed by the county board.
Okay. So we're sending our recommendation on to you.
Okay,
And then, okay. So then if you could just stay on for 13 and 14, I think,
okay,
just so that you're here and aware, I guess. And then you can
Yeah.
take off. All right.
Yeah, and I'll be
So-
sending these all, more of the detailed, Clint, to you in email like I usually do once this meeting's done.
perfect. Thank you. I'm hoping to get a committee lined up so we can take action on confirmations next Tuesday.
All those in favor of approving Julie to be on our Aging and Disability Board, signify by saying aye.
Aye.
I,
Those opposed say nay. Motion carries. So agenda item number 13 is approve our comprehensive community services, our CCS coordination committee membership list. Any additions or corrections that are made to this list of CCS?
No, Mr. Chair.
Wonderful. The motion should be appropriate. I would make a motion then to approve our CCS committee members. There be a second?
second,
Seconded by Dr. Barris. Any further discussion? Hearing none, all those in favor signify by saying aye.
I,
Opposed, say nay. Motion carries. So agenda item number 14 is approve our coordinated services team coordinating committee membership list. Are there any additions or corrections to this list that is made, or is it still the same people?
I believe this is the correct list.
Okay. What is the committee's or the commission or the board's wishes?
I have a question on both of these. It says in an effort to increase attendance, it says you'd like to offer per diems and mileage reimbursement. Is that something that had to go through some sort of, that had to go through like finance and personnel, or was that just your decision and within the house?
I believe in order to offer per diems, it has to be approved an official county committee. And I think that work has already been done. I don't know if Miranda, you might have been here at the time when that did go through the county board. Is that correct?
Yeah, I actually wasn't here. I just found it in old minutes. It looked like it was approved by Personnel and Finance. I'm not sure it went on to be approved by county board way back in 2014.
It was here.
So, but I can't say why we never offered that. And then there was an effort when I was here, when our corporation counsel was Attorney Southwick, to take it. And I believe that at that time it never made it past Personnel and Finance. So yeah, I'm not sure of the steps to get it enacted beyond this, but.
So we already have the approval that it's a county committee. Is that what you're saying, Tracy? And so now we have the ability to just offer that?
Yeah, my understanding is, and I think we'll have to research this to make sure that I'm correct, is that only official county committees can offer a per diem. These two committees have both been official county committees for quite some time. So as long as I'm correct that a per diem can be offered if it is a regular committee approved by the county, then we would do that based on what we have budgeted in our budget.
You know, when I was on CCS committee, I believe that I was presented with a slip that I could claim per diem for that. And I don't think it's fair that if the county board supervisor attends that meeting, that they're the ones that gets it and not anybody else. So, Van, you attend the CCS meeting? You must be off right now. Miranda, when you host that meeting or when you run that meeting, do you offer a per diem to board members that attend?
Yes, just board members.
Just board members. I don't think that's fair, but.
So my question was just how the language is stated, like if there was some way we had to present this or if we can just approve this as stated. But I mean, are there any other committees made up of other non-board members that offer per diems to the non-board members so that we can just say this is great and move on?
Yes,
Mr.
Parks is one. Go ahead, Van.
I don't charge a per diem. I opt out of that.
But you're offered one though. That's what I was getting at. Like, you were
Yes,
offered.
but I don't take it.
So Carrie, you were gonna say that Parks and Rec has multiple members and they offer it to everyone?
Parks has 3 citizen members and they, we have Health and Human Services Board has got 3 citizen members. I think this would be a subcommittee of the Health and Human Services Board,
Okay,
essentially.
all right. Well, I don't know if Clint's still on, but if there's no issue with it, then I'm fine with making a motion to approve this.
I would just say if these folks are are going to be receiving a payment from them, we're going to have them their pay information kind of brought to us so that we can get them an appropriate W-2 furnished at the end of the year. So we're going to have their financial information brought in.
I was just going to mention, I think these are the only 2 committees that don't pay per diems. Almost every single one that is involved with HHS does. So this would be new, but precedence has already been set. And yes, Clint, I usually tell the managers they've got to get all of their new people over to meet with Tammy.
Okay, so I'll make a motion to approve this with the understanding that that will be communicated to the board members.
So we got a motion by Ingrid to approve our coordinated services team coordinating committee membership list with the understanding that we're going to work through getting them a per diem and the needed materials or the needed information to follow through with this. Is there a second?
Second, Tim.
Seconded by Timothy Gotchel. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Aye. Those opposed say nay. Motion carries. Mr. Langrick, I don't think you're needed anymore. You're more than welcome to stay if you would like to.
Thank you, Mr. Chair.
Aye. Moving on to our next agenda item is number 15, approve the Health and Human Services 2022 Public Health Fee Schedule.
Yes, I took a look at the previous listings that we've had throughout the years, and I winnowed it to just reflect those services for which we are requesting a fee schedule approval. And I made no changes. Again, we'll be able to hold, I believe, with the costs associated with this fee schedule for another year. So I would ask that you please review and approve that as per my request.
We have a motion to accept the fee schedule.
So moved.
Motion by
Second.
Ingrid, seconded by Dr. Barris. Is there any discussion? One question I guess I have is, what about the COVID-19 vaccine? Is that something that's free? It is? Okay.
The vaccine itself is a federal asset that is provided to us through the CDC in the state of Wisconsin. And we here at Health and Human Services decided early on to waive the administration fee that some administrators or some vaccinators charge. But given the amount of overhead required and then also the staff time involved with the billing aspect, we thought it would be just in our best interest to operate free as we do the vast majority of the vaccines we provide.
And that would be the booster shots too? Okay. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. Agenda item 16 is approve our 2022 behavioral health services fee.
So for behavioral health, there's three changes. Our psychiatric fees went up between 1% and 2% from 2021 to 2022. And then way down at the bottom, our choices group, we actually run that through Prime for Life. And just to cover our costs, that went up to $175. In the previous year, it was $166 for either a class held over several evenings in the course of a month or 1 or 2 full days.
Motion would be appropriate to approve this fee schedule for our behavioral health services.
I'll move to approve.
Motion by Dr. Barris. Is there a second?
Second.
Seconded by Ingrid. Any questions or discussions? This one question I have, Miranda, is a lot of these fees, are they covered by insurance?
Yeah, these are the private pay fees. The majority of individuals have an insurance of one type or another to cover.
I see. Okay. Any further discussion? Hearing none, all those in favor signify by saying aye.
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 Opposed, say nay. Motion carries. We have reached the end of our agenda. Agenda number 17 is adjourned. When
So
would our
moved.
next motion by Ingrid, seconded by Van Nelson? When is our next meeting? January 14th?
I don't have it.
12th, January 12th.
No, the 12th is a Wednesday. It's the 13th.
13th. All
You
right.
had it right.
Yeah. All right. All those in favor signify by saying aye.
Aye.
Aye. Opposed, say nay. We are adjourned. Thank you, everybody, for taking time out of your day to attend this meeting.
Merry Christmas.